For doctors and nurses on the front lines, a new weapon in the fight against COVID-19, an antiviral medication proven effective in clinical trials. Dr. Fauci announced the breakthrough at the White House.
The data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. This is really quite important.
The drug is Remdesivir, made by Gilead Sciences. It comes in IV form, administered to the sickest COVID patients. The drug trials involved nearly 1,100 people worldwide. The preliminary NIH data showed Remdesivir cut the recovery time in the hospital from 15 to 11 days. The mortality rate also dropped, though not dramatically, from 11.6% for those on the placebo to 8% for those on Remdesivir.
And Tony Fauci knew that Remdesivir would kill you. No treatment until you go to the hospital. Then your treatment are two things that are bound to kill you: ventilators and Remdesivir. And Tony Fauci knew that Remdesivir would kill you. He knew that because in 2019, he tried to use it for Ebola. 2019, he tried to use it for Ebola, and within 5 days of treatment, it gave lethal side effect to 54% of the people, and the Safety Monitoring Board ordered him to terminate the use of that drug. And he, through a phony, contrived, absolutely fraudulent study that he manipulated and orchestrated, got that drug made standard of care. It is homicide. And if you look, how does it kill people? 2 ways, 3 ways. Kidney failure, heart failure, and all organ collapse. And what happened to the people who died in the pandemic? What were they dying of? Kidney failure. All the doctors said, you heard it again and again, we've never seen a virus that attacks the kidneys. Because it wasn't the virus. It was the Remdesivir. And he denied them deliberately, purposefully, access to the things that we know work, because 248 studies show they do, which is ivermectin, hydroxychloroquine, and all the other, even monoclonal steroid antibodies, which they know work.
Ralph Baric, the inventor and the weaponizer of coronavirus, also had the hand in developing Remdesivir, the drug that was allegedly used to treat patients with COVID, except for the fact that by 2018, that drug had a kill ratio of 53%. Documented, published. It was so deadly that the World Health Organization itself pulled the drug from consideration for Ebola treatments. And ironically, inside of the documents that nobody bothers reading, the death rate occurred regardless of viral load, which means that people were killed who didn't even have Ebola. The death rate at 53%, and we let that publication of information in 2018 fail to inform our decision in the spring of 2020, when Anthony Fauci, Ralph Baric, Peter Daszak, and others made the decision that we should inject Remdesivir into patients with COVID. We knew we were going to kill people. That's premeditated murder. We knew we were going to do it, and we went along with it anyway. And sitting right next to the president, Donald Trump, he signed the death warrant for millions of Americans, with the criminals sitting right next to him. Possibly one of the most interesting coups in human history, where the perpetrators of the coup were literally sitting in the Oval Office on a sofa right next to the president. And what he didn't know is that he was signing the death warrant to American citizens.
The Gilead study confirmed giving Remdesivir for 10 days to 53 COVID-19 patients early on before May 2020. They found that it caused multiple organ failure, acute kidney failure, septic shock, and hypotension in 31% of all people they gave it to. And multiple people in that 10-day trial, their kidneys died and needed emergency kidney transplants. Why did this get my attention? March and April of 2020, New York City was reporting as the epicenter of COVID-19 in America. Every press conference I watched when they were interviewing medical doctors, they all stated the same thing every time. Every time we start treating these respiratory virus patients with this new novel coronavirus, this respiratory virus moves from the lungs and goes to the kidneys. We have never seen a respiratory virus ever attack kidneys like this before. It causes such severe acute kidney failure, we're not only short on ventilators, we don't have enough dialysis machines to handle the kidney failure. I knew right away from the Gilead study, conducted 2 months earlier, that the entire kidney failure, multiple organ failure, was a result of remdesivir and had nothing to do with the virus. And that is absolutely true. I said in May of 2020, went to the media, I said everyone needs to be warned that Anthony Fauci has declared a drug to be the solution to a pandemic for all innocent Americans. He is going to kill hundreds of thousands, if not millions, of innocent Americans with this drug.
Attorneys Dan Watkins and Michael Hamilton announced in a national press conference on the 7th of this month the filing of their landmark lawsuit against these 3 major hospitals on behalf of families who lost their loved ones with the bounties paid to hospitals for using Remdesivir. I like that they're using it, the bounty that was paid.
But I am very, very pleased to announce that this morning we filed 3 complaints on behalf of 14 Fresno area families who lost loved ones at the hands of those healthcare providers who used Remdesivir to treat COVID. The Remdesivir killed their loved ones, and we're filing a lawsuit to seek redress for those wrongs. The 3 hospitals that we filed against are Clovis Community Medical Center, Community Regional Medical Center, and St. Agnes Medical Center. And there are several healthcare providers, individuals associated with the care that are also going to be named in the lawsuit, have not been yet. And we're doing that to make sure they're held accountable for what they did. The claims are based in 2 basic concepts, pretty simple stuff, but very, very egregious and fundamentally wrong. Medical deception. Deception of the patient who becomes a decedent. Deception of the loved ones who need to have the information to make informed decisions. And then we have, beyond that, we have actual unconsented to medical care. Unbelievable in this society, in this day and age, with the trusted healthcare industry that's supposed to be doing these types of things. The 4 causes of action are the same in each complaint. We have fraudulent concealment, elder abuse, where the case might be for the age of the decedent, medical malpractice, and battery. And not simple battery where they didn't get consent. Actual unconsented to treatment that was not consented to. Battery. In essence, we allege the defendants had information that they intentionally did not provide to the decedents or their family members. Information about the dangerous nature of Remdesivir, its history, its lack of effectiveness in prior use. Information that would have changed the decisions of those people in the hospitals had they been told. Information was held from the patients and from their family members regarding safe and effective methods of treatment for COVID. Safe over time. No problems with the care. Very efficacious. And you're going to hear all about that from our esteemed panel of experts here in a minute. They intentionally withheld that information. And in some cases, they intentionally provided Remdesivir over the objections of the decedent and their family members. And that is not an exaggeration. We have evidence of it, eyewitness testimony, and other evidence that we'll be presenting. Beyond that, they administered this care and did all of this stuff for financial incentives provided to them by the state and others. They withheld effective means of treatment to run Remdesivir as the only solution because of the financial incentives provided to them.
The Virus Law Group have submitted requests to the district attorneys of 9 Louisiana parishes to initiate criminal investigations into alleged crimes committed by Dr. Fauci and other officials. The criminal referrals accuse Dr. Fauci, current and former federal officers, and hospital systems providing care within Louisiana of committing several crimes under Louisiana Criminal Code, including terrorism by causing intentional killing or infliction of serious bodily injury, first-degree murder, second-degree murder, manslaughter, human trafficking,
prohibited racketeering acts, cruelty to persons with infirmities, false imprisonment, second-degree kidnapping, simple battery of persons with infirmities. The individuals named as subjects of the requested investigation are high-profile figures including Anthony Fauci, ex-director, National Institute of Allergy and Infectious Diseases; Cliff Lane, Deputy Director, National Institute of Allergy and Infectious Diseases; Francis Collins, ex-director, National Institute of Health; Deborah Birx, ex-White House COVID response coordinator and former director of DoD HIV research at Walter Reed Army Institute of Research; Rochelle Walensky, ex-director, Center for Disease Control and Prevention; Stephen Hahn, ex-commissioner, Federal Drug Administration; Robert Redfield, ex-director, Center for Disease Control and Prevention; Peter Daszak, president of the EcoHealth Alliance; Rick Bright, director of the Biomedical Advanced Research and Development Authority. If you made it this far, you're not here for headlines. You're here for what they're not telling you. Subscribe now, because next time we go deeper, and truth has fangs.